Mechanical complications. These are the most dramatic and dreaded complications. Most dramatic complication of any patient with ACS. Most dramatic complications. This is because of tearing or rupture of a acutely infarcted tissue. Okay. So what are the mechanical complications that you can see post-MI? So you can see papillary muscle rupture. Okay. You can see a papillary muscle rupture. Incidence is very, very less, 0.1 to 1%. 0.1 to 1%. Patient usually presents to you with severe acute MR, okay, with pulmonary edema. Okay. Somebody comes to you with severe pulmonary edema, you put a probe and see, you see severe MR, okay, and then there's a mass which is hanging in the LV. So most likely that is the ruptured papillary muscle. Okay, so you can see a mobile mass in the LV prolapsing into LA. So you can have an eccentric broad jet of severe MR. Okay, most commonly which papillary muscle is involved? Posteromedial papillary muscle. Why? Because of single blood supply. Anterolateral papillary muscle has dual blood supply. This we have already seen, dual blood supply. So posteromedial papillary muscle is responsible for this ischemic MR more commonly. Okay, so that is one mechanical complication. Okay, the second one is the septum gets ruptured. Okay, ventricular septal rupture. You see, so ventricular septal rupture. The incidence is again low, just 0.2 to 3%. See, all this mechanical complication have bimodal presentation. All of them can present within 24 hours or any time after 3 to 5 days. Okay, people used to say this PSR was within 24 hours, this free wall rupture was later. So nothing of that sort. Anything, this is the reference is from Brownwall. Okay, you can see there's a clear-cut tabular column which is given in Brownwall. So they all have bimodal presentation. Anything can happen within 24 hours or anything can happen at 3 to 5 days. Okay, so ventricular septal rupture, they can be asymptomatic to cardiogenic shock. So there's usually a left to right shunt because the pressures on the RV side is lower always. So this behaves like an acquired VSD only from left to right shunt. Okay, so managed surgically. You put a stent and see, you hear a harsh pansystolic noise. Contained rupture, very, very less common. Okay, so patient can be asymptomatic. There's a small neck-like communication to and fro, blood or communication through the rupture. These patients, they remain stable, can be operated. The mortality rate is slightly less with contained rupture. And when you have a free wall rupture, they present to you with tamponade, shock, nothing, pericardial effusion, tamponade. So before even you recognize this patient die. So that's how it is. So the free wall rupture also can occur within 24 hours, and the second part of presentation is 3 to 5 days. They can have syncope, sudden hypotension, and then death. So one point here is they are more common on the LV side rather than on the RV side. Okay, so they are common in old age, especially females, especially post-lysis, and when it is an anterior wall ischemia or first MI. Recurrent MI, first MI, more common. Okay.